Welcome to Summarize Science, where we break down the latest breakthroughs in technology and health. Today, we are looking at a fascinating study titled Imitation Learning for Robot Assistance in Open Surgery. Open surgery is still the most common way to treat patients worldwide, but there is a massive global shortage of trained surgical assistants. To solve this, researchers investigated whether low-cost robots could learn to take over repetitive assisting tasks. The primary task they focused on is called suture following, which is a cycle of grabbing, pulling, and releasing surgical thread. In this visual overview, you can see the 4 distinct phases the robot must master to help a surgeon effectively. Phase 1 involves holding the thread taut, while phases 2 and 3 involve tracking the surgeon's movements. Finally, in phase 4, the robot acquires the thread again to repeat the cycle for the next stitch. Existing robotic systems usually focus on automating the surgeon's role in minimally invasive procedures, but open surgery remains largely unstudied. The researchers used an accessible, non-specialized robotic platform to collect 160 demonstrations of a human performing these moves. By using imitation learning, the robot is essentially learning to copy the behavior of a skilled human operator. This approach is much faster than traditional programming because the robot learns from visual examples. The team compared 4 different AI architectures to see which one acted as the best brain for the robotic arm. These included a transformer-based model called ACT and a large-scale vision-language action model known as Pi0. By testing different models, they could see which ones were best at handling the precision required for medical work. The follower robot arm used in the study is an open-source design equipped with simple webcams for eyes. The researchers define the task as a robotic counterpart to a human assistant who tracks the moving suture and keeps it out of the surgeon's way. Because the thread is very thin and has low contrast, the robot needs sub-centimeter precision to be successful. To see if the robots were truly ready for the clinic, they were evaluated on how much data they needed to learn the task. They also looked at how the robot's performance changed based on different camera angles and background clutter. When a robot failed, the researchers categorized the errors into 3 types: lateral errors, depth errors, and total task breakdowns. A lateral error happens when the robot is too far to the left or right, while a depth error means it missed the thread by being too shallow or deep. The results showed that the largest model, Pi0, achieved the highest success rate at 75% under ideal conditions. Interestingly, depth errors were the most common reason for failure across all the different types of AI brains. This suggests that accurately judging distance is currently the hardest part for a robotic surgical assistant. In this chart, we can see that as the robot is given more training data, the number of total breakdowns decreases significantly. The green sections represent successful episodes, showing a clear improvement as the robot gains more experience. When the researchers intentionally made the background messy to simulate a real-world environment, the simple models failed. However, the more advanced models that were pre-trained on general information about the world remained functional. This indicates that future surgical robots will benefit from being smart before they ever even enter an operating room. In a final test, the best-performing robot was put into a live trial with a real surgeon performing stitches. The robot successfully completed 23 out of 25 stitches, resulting in a 92% stitch completion rate. This is a massive milestone, showing that robots can move at the rhythm of a live surgery without slowing the surgeon down. To recap, the researchers have proven that general-purpose AI can be adapted for the high-stakes environment of open surgery. They found that large, pre-trained models are the most robust against the visual noise found in a typical hospital. In the future, these systems could reduce team size requirements and help surgeons focus on the most critical parts of an operation. This work marks a major step toward making robotic assistance a common sight in hospitals everywhere. Thank you for watching Summarize Science, and we will see you in the next breakthrough.